Good morning or good afternoon, everybody. I'm going to be doing my ADPIED presentation on diabetes. The etiology of diabetes, a group of diseases that result in too much sugar in the blood. When you have sugar in your diet, it is sent to the blood and the blood signals the pancreas to release insulin. If you have diabetes, your body either doesn't make enough insulin or you can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to the insulin, too much blood sugar stays in your bloodstream. You have type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 is a chronic condition in which the pancreas produces little or no insulin. Type 2 is a condition of the way the body processes blood sugar. Gestational diabetes is a form of high blood sugar affecting pregnant women. Here are the types of diabetes in more detail. Type 1 diabetes is usually diagnosed in children, teens, and young adults, but it can develop at any age. This is when your pancreas doesn't make insulin or makes very little insulin. Insulin is a hormone that helps blood sugar into the cells in your body where it can be used for energy. Symptoms of type 1 include nausea, vomiting, and stomach pains. Also, symptoms can develop in a few weeks or a few months. Type 2 is where cells don't respond normally to insulin. This is called insulin resistant, usually when the patient is overweight. Your pancreas makes more insulin to try to get cells to respond. Eventually, your pancreas can't keep up and your blood sugar rises. Type 2 diabetes most often develops in patients over age 45. Here are some symptoms below, including very hungry, have blurry vision, have numb or tingling hands or feet, feel very tired, have more infections, have sores that heal slowly, and xerostomia. Gestational diabetes is a condition in which your blood sugar levels become high during pregnancy. There are two classes of gestational diabetes. Women with class A1 can manage it through diet and exercise. Those who have class A2 need to take insulin or other medications. It affects up to 10% of women who are pregnant in the U.S. each year. It also can cause health risks for the baby as well, more likely to have type 2 diabetes later in life. The patient with gestational diabetes usually goes away after pregnancy. Symptoms are thirstier than usual, hungrier, and eat more than usual, and urinate more than usual. Here are some diagnoses that show if you have diabetes or not. You have A1C test, measures your average blood sugar level over the past 2 or 3 months. Fasting blood sugar test measures your blood sugar from overnight. After you haven't eaten the whole night, it's kind of like basically a fast. Glucose tolerance test measures your blood sugar before and after you drink the liquid that contains glucose. And then a random blood sugar test measures your blood sugar at the time you're tested. Oral health complications with diabetes. People with diabetes have a higher chance of having periodontal disease, which can lead to decay, major bone loss, tooth loss, and infection around the body. Patients with diabetes are very slow healing to infections and sores in the mouth. Diabetes also causes poor blood flow to the gingiva, which causes more infection in the mouth. They also develop xerostomia, which can lead to ulcers, soreness, and tooth decay. They also experience thrush, which is a yeast-like fungus that's called Candida albicans, where it overgrows in the mouth and throat. Also, they have such a thing called ketone, breath to smell like nail polish, or acetone, when your insulin levels are dangerously out of control. So with the ADPIED, I start with assessment, which will look over medical and dental history, make sure the patient has eaten that morning or that day if it was in the afternoon, taken their prescribed medication, periodontal status of the patient, and check to see if the patient has ketone breath. Diagnosis: the patient's oral health, including infection, decay, bone loss, etc. Identifying the patient's major complaint for the appointment and x-rays. And then planning, patient's goals and objectives, planned sequence of how many appointments it will take to treat the patient, and patient participation, how well the patient will comply to treatment. And then you have implement, which is treatment, whether it's scaling and route planning, debridement, prophy exam, x-rays, emergency appointment, is understood and agreed to by a patient and then done so for the safety of the patient. Patient receives appropriate post-appointment instructions and recommendations for pain control, if any, and also recommendation for antibiotics such as Paradex to help healing after treatment. Clinical evaluation of the patient oral health progress after the treatment. Schedule for more appointments to maintain oral health. Always review and discuss with patient the progress after each treatment. And then last, you have document. Update medical and dental history at each visit. Document patient's vitals from each visit. Patient treatment of each visit. Note any adjunct aid given to patient to help with treatment. Note any accommodations for the patient for each visit. This is my adjunct aid, a rubber tip stimulator, helps promote blood flow to the gingiva and massages the gingival tissue. I got this from Walmart. This is not the exact brand. It also comes with a mirror and it looks like a scaler, but it's not. It was pretty cheap. Well, I think they're at every Walmart, very easy to get your hands onto, especially the one I have in my picture. What you do with this rubber tip stimulator, what you would tell your patient is you would take it, this rubber tip right here, and you would go in between interproximal and cervical and massage with a circular, gentle motion. Don't know if y'all can see. There you go. This helps with blood flow, considering that patients with diabetes normally don't have a lot of blood flow in their gingiva and the mouth, and this will help with preventing any infection or bone loss. And here are my references. Thank y'all so much for listening today, and I hope y'all all have a good day. Thank you.